Hello everyone. Sorry for the delay because I was not feeling well. But today I'm with the 2020 INICET anatomy paper. Let's discuss as much as possible. Okay. First question. What is the action of the muscle at the hip which is attached to the marked area in the image below? So what they have marked the swan. This is nothing but a gluteal tuberosity. Which muscle attaches there? Do you remember? It's a gluteus maximus muscle attaches to the gluteal tuberosity. So what is the action? It helps in extension. It is muscle of the back, isn't it? So back of the thigh. So it helps in the extension and lateral rotation of the hip, and also it helps in abduction. This is the repeated question, so remember. Next, which nerve supplies maximus muscle? It is a maximus, but it is supplied by the inferior gluteal nerve. Okay, so it helps in with what? Which option? It helps in extension and lateral rotation. Is correct. It helps in abduction. Is correct, but not external rotation. Extension correct, not adduction, and lateral rotation correct. Helps in flexion and abduction? No, it helps in extension and abduction. So here option is the second, option B is the correct one. Option B. Next, coming to which of the following bony structure is present behind the marked area? This is the pterion. So what is pterion? It is the place where the four bony structure meets. So which all bony structure meets at the pterion? It is a frontal bone, parietal bone, and greater wing of sphenoid and squamous part of the temporal bone. So, why we are concerned with this? When there is a fracture of the pterion, the main artery is middle meningeal artery will get ruptured and there will be an extradural hemorrhage. This is the important question because they have asked in one or other ways. Now they have asked which bone is present behind this, isn't it? Sometimes they will ask which artery is present behind this, that is middle meningeal artery. And there is a middle cerebral vessels, sylvian fissure, and insula. Broca's motor speech is also present behind this, and the lesser wing of sphenoid. In all these things, sixth one is the bony structure. So lesser wing of sphenoid is directly present behind the marked area. So lesser wing of sphenoid. Identify the foramen marked in the image below. This is the sphenoid bone they have marked. This is the medial side is the pterygoid canal, and the lateral to it is a foramen rotundum. Foramen rotundum. What are the structures coming from foramen rotundum? It is a maxillary branch of the trigeminal nerve passes through it. Whereas in pterygoid canal, median nerve passes through it. Next, coming to the fifth question, fourth question. Pretracheal layer of the deep cervical fascia encloses all except they have asked. Actually, pretrachea means something that is covering all the structures that is near the trachea. What is it? Thyroid. Trachea, in front of it, which gland is there? Thyroid gland. Yes. Sternohyoid and esophagus is behind the trachea. Yes, correct. Sternohyoid is also somewhere this side, whereas sternocleidomastoid is the muscle which is covered by the deep cervical fascia here. Okay, let me show you the picture. See, this is the sternocleidomastoid, which is covered by the investing layer of the deep cervical fascia, whereas this is the pretracheal fascia, whereas around the vertebra, this is the prevertebral layer. Here, trapezius muscle is also covered by investing layer of the deep cervical fascia. Coming to the fifth one, which of the following differentiates the exocrine pancreas from the parotid gland? They're asking what is the histological difference they're asking. So, one is pancreas, they're asking exocrine pancreas and the parotid gland. Let's see the explanation. The exocrine pancreas is composed of entirely serous acini. Hence, its general structure is similar to that of parotid. Okay, serous acini, it consists of serous acini, hence it is almost structure is similar to the parotid gland, but you can differentiate it by two features, that is the excretory duct of the parotid gland is striated columnar, whereas excretory duct of pancreas is simple columnar. Understood? Mm, Parotid gland, let's think this is the one acini and this is the acini of the uh, pancreas. They are telling that the excretory duct of the parotid is striated columnar. Striated columnar. Okay. Whereas pancreas is simple columnar, not striated. It is simple columnar. It has become cuboid, but please adjust. The parotid glands has striated and intercalated interlobular ducts, whereas pancreas has only intercalated type. Parotid has both types of ducts, that is striated and intercalated interlobular ducts, whereas pancreas has only intercalated type. This is little bit a tricky question, but you should at least know the answer. It is differentiated by absence of the striated duct. The basal lamina lining the serous acini, no. Presence of serous acini with acidophilic, no. Presence of apical acinar villi, no. Only striated duct we have seen, isn't it here? Here, see, in the parotid there is striated duct, whereas in the pancreas there is no striated duct. So, absence of the striated duct in the pancreas will differentiate it from the parotid.